Cagney Martin wants us to rethink how we view dementia care and the elderly. She wants us to lead with our hearts, appreciate the present, and consider both the impact we have on others and the impact people with dementia can have on us.
You know what it is? It's basic human kindness. It's understanding that my heart is fully working and so is yours, so we can connect.
Cagney is a messenger of a new approach to caring for those with dementia, encouraging people to focus on what the person can do rather than what they can't do.
You know, you have 100 billion brain cells, you have $100 billion. Even if somebody takes 3/4 of that away, you're still left with millions of brain cells, millions of dollars that nobody's going to say, no, that's not enough money for me. You're going to work with that, and all those, cells, all that money that holds hope for people. The more that we help CNAs see the difference, the more they're going to impact the families who are coming to visit their loved ones. It doesn't have to be so bad. You can live a good life with dementia, and I don't think everybody believes that.
That approach guides her role as Life Enrichment Coordinator at Legacies by the Lake, a groundbreaking dementia care program at Mount View Care Center. Cagney is a third-generation caregiver at Mount View. Her grandmother, Rosemary Lang, began as a certified nursing assistant at Mount View in the mid-70s, providing personal care for nearly 25 years.
She took the time to talk to the residents, and she always says the more that I knew about the residents, the better I was able to take care of them.
Cagney's mother, Sandra Lang, also works at Mount View as a Life Enrichment Coordinator and CNA. She brought Cagney to visit Mount View as a young girl, just as Cagney brings her girls, Reagan and Kirby, to visit. Because of her experience and training, Cagney's view of how to care for and interact with the elderly is enlightened and pragmatic. In her role conducting activities for residents, Cagney sees possibilities, not barriers. She has helped plan and organize such non-traditional events as a fashion show, prom, and new this fall, a homecoming event, complete with a visit to Wausau East High School. She leads resident group outings to destinations both near and far, and develops stimulating activities and new connections.
It's about leaving here and feeling like you made a difference to somebody. Well, I think if I leave with one smile a day, I've accomplished what I'm supposed to do.
And although she's champion of new perspectives and approaches, there's one perspective Cagney hasn't changed: her respect and admiration of Mount View caregivers, the CNAs who have a positive impact on the residents and their families.
Can you ever really say that you held the hand of somebody right before they died? You were the last person that got to be with that person when they died because their family couldn't be here. I think it's amazing, but they don't get the opportunity to stop and think about that, so I try to remind them that.